Hello everyone. Today's interesting topic is ureter. This is the contrast radiograph of the KUB, kidney ureter bladder region. You can see the minor calyx, minor cup-like structures, major calyx, big cup-like structures, and the pelvis of the ureter. Here is the ureter, which descends vertically downwards across the tip of the transverse process of lumbar vertebra. It's crossing the sacroiliac joint, coinciding the greater sciatic foramen. That notch is running downwards, forwards, and medially. Here we can see the bladder is filled with the dye. This is called as a descending phylogram, where phylo refers to the pelvis of the ureter. Here you can see on the left hand side, this is right, half or right, this is left hand side. Here the kidney outline is okay, but here on the left hand side we can see dilated pelvic calyceal system and the ureter. It's a hydronephrosis. Maybe there is a block over here in the lower portion. It's a black shadow here, maybe due to a stone in the lowermost portion of the ureter. Next slide. This is a normal descending phylogram. You can see the size of the minor and major calyx and the pelvis of the ureter. And this is the ureter, we can see crystal clear. Okay. You can also see the transverse process of lumbar vertebra, sacroiliac joint, retrosciatic notch, ending the bladder. See, there is no filling defect in the bladder here. Crystal clear. There is a descending phylogram or intravenous phylogram. Whenever we are doing such radiographic procedure, the contrast radiograph, the dye is injected into the vein of the patient. The renal function test should be normal prior to the test. So the dye gets filtered through the glomerulus of the nephron and is present in this area. Ultimately, there is no obstruction in this tract called the urinary tract. Then the dye will end up in the bladder and urethra. The dye is descending down, so it's also called as descending phylogram. It is injected in the veins of the patient, so it's called intravenous phylogram. So, kidney, ureter, urinary bladder, and urethra. These are the part of the urinary system or the excretory system. More often than not, there is an obstruction due to a stone, ureteric stone, because it's a narrowest part of the urinary tract. So it's also called as ureteric calculi. The other name of stone, the medical student should be calculi. Okay. Coming to the referred pain, this patient with ureteric colic, what we call, the referred pain is towards the umbilical region. That is because the afferent from the ureter passes to the T10 segment of the spinal cord, but on day-to-day basis we are getting information from skin, right? So the efferent comes and projects to the skin of the umbilicus. More often than not, the renal angle area, this area, loin area, the pain will be there. But if the stone is descending down in the ureter, the patient classically complains of the pain radiating from loin to groin. So this is a loin, the upper portion of the hip, and the genital area is called the groin. So loin, L-O-I-N, to groin, G-R-O-I-N. Radiation of the pain also will be there. So ureter, specific learning objective, introduction, measurements, course, relation, blood supply, nerve supply, and clinical importance of ureter, which we just now saw it. So in the ureter, it's a fibromuscular tube beginning from the hilum of the kidney on the medial side. It descends vertically down, coinciding with the tip of the transverse process of lumbar vertebra. When it enters, it crosses the sacroiliac joint, enters the pelvis in the lateral pelvic wall, and finally ends in the urinary bladder at the trigone of the urinary bladder. So this ureter is a narrow, thick-walled, expansile muscular tube. It's made up of smooth muscles. It conveys the urine from the kidney, from the hilum of the kidney to the urinary bladder. The urine is propelled from the kidney to the urinary bladder by the peristaltic contraction which is happening in the wall of the ureter. The measurements of ureter from here to here is length is 25 centimeters or 10 inches, whereas the diameter is only 3 millimeters. That is the most important thing. Because of this diameter is so narrow, if at all you don't drink adequate amount of water, which is 3 to 5 liters per day, then there is a concentration of the ions here too much of concentration of ions, it will precipitate as stone and will get stuck in the ureter. The course of the ureter is very simple. We can divide it into upper part of the course and lower part of the course. Upper part is in the abdomen. It is descending vertically down across the tip of the transverse process of the lumbar vertebra. So here is the upper pole of the kidney at L1, lower pole of the kidney at L3. So the ureter begins at L2. It begins from a funnel-like expansion called the pelvis of the ureter, descends vertically downwards across the tip of the transverse process of lumbar vertebra, then crosses the sacroiliac joint and the bifurcation of the common iliac vessels. It leaves the abdominal cavity to enter the pelvic cavity. In the pelvic cavity, in the lateral pelvic wall, it coincides with the greater sciatic notch, then up to the ischial spine. From the ischial spine, it moves downwards, forwards, and medially to end up in the urinary bladder. So that is of course here additional relation in the posterior abdominal wall. Can you see this muscle here? It's called the psoas major muscle. So ureter is resting on the psoas major muscle in the posterior abdominal wall. Same thing, ureter begins as a downward continuation of the funnel-like expansion called the renal pelvis, the medial margin of the lower end of the kidney. Then the ureter passes vertically downwards and slightly medially, running on the psoas major, which we just now saw. Then this muscle separates the ureter from the transverse process of the lower three lumbar vertebrae. It enters the pelvic cavity by crossing across the bifurcation of the common iliac vessels, which is overlapping the sacroiliac joint. So this is the overlapping of the ureter on the bifurcation of the common iliac vessels, that is in turn overlapping the sacroiliac joint. In entering the pelvis, it coincides with the greater sciatic notch. See? In the lateral pelvic wall, it goes at greater sciatic notch. At the level of ischial spine, it moves downwards, forwards, and medially to end up in superolateral angle of the tricone of the bladder. As a course in pelvis, which we will see one by one. Ureter first runs downwards and backwards, coinciding with the greater sciatic notch. Then, opposite the ischial spine, it moves downwards, forwards, and medially to reach the base of the external tricone of the urinary bladder. Within the bladder wall, it runs oblique. This is important because it prevents the reflux of the urine back into the ureter. Within the bladder wall, it narrows down to take a sinus course or S-shaped course, opens with the cavity of the bladder at the lateral angle of the tricone as the ureteric orifice. The parts of the ureter we can divide into upper part, middle part, and the lowermost part, or just upper and lower part. Upper part is there in the abdominal cavity, it's called the abdominal part. Lower part is there in the pelvic cavity, so you can call it as the pelvic part. This lowermost part is within the urinary bladder, so intravesical part, don't worry about that. So this is again to show you the abdominal part of the ureter. It's 12.5 centimeters. Pelvic part of the ureter is also 12.5 centimeters. Equal divisions are there. Two parts. I just want to show you abdominal part and pelvic part. Each is equally divided into 12.5 and 12.5 centimeters. Abdominal part of ureter extends from the renal pelvis, from the hilum of the kidney, the bifurcation of common iliac vessels. The pelvic part begins from that bifurcation of the common iliac vessels, the base of the urinary bladder. Come to the relations, most simplest actually. Medially, the ureter is related to the IVC. You can see in this diagram, this is the IVC, inferior vena cava. Okay. Also to the gonadal vessels, and on the left side there is additional vein called as inferior mesenteric vein. So same thing you can see here, inferior mesenteric vessel. The pelvic part of the ureter crosses in front of all the nerves and vessels in the lateral pelvic wall except vas deferens, which is coming in front of the ureter. Actually, near the uterine cervix, the uterine artery lies above and in front, and it is important surgical relationship in female, especially during hysterectomy or removal of uterus. You can see that here. The pelvic part, all the vessels on the lateral pelvic wall are branches of this internal iliac artery. It's lying in front of it, but itself is crossed by this vas deferens in male. So here also it can cause a constriction. You can see that. Then in female, one artery will turn from lateral to medial side. That's a uterine artery to end up to supplying the womb of the mother of the uterus. So that will be crossing the ureter from lateral to medial. Constrictions of ureter are mainly 3 in number at the following sites. At the pelvi-ureteric junction between the pelvis of ureter and the body of the ureter. The second one is at the pelvic brim or at the level of bifurcation of common iliac vessels. The third one is vesico-ureteric junction between the bladder and the ureter. Additional constriction is noted by surgeons, but mainly these three constrictions is important. Pelvic ureteric constrictions, first one. Second, constriction of the pelvic brim or the bifurcation of the common iliac vessels into external and internal iliac vessels. The third part is vesico-ureteric constriction. The additional constriction told by the surgeon are at the level of vas deferens, crossing of the vas deferens, and at the level of opening at the level of ureteric orifice in the trigone of the bladder. That is the additional constrictions. Okay. Please remember these three constrictions, it's important. At the pelvic ureteric junction, the pelvic brim, at the vesico-ureteric junction. The arterial supply, just imagine ureter has to be a toll. This is one state and this is another state. To cross the state there will be a toll. You have to pay the toll. Whatever vessels crosses this, here we can see in this diagram, the gonadal vessels, the right colic vessels, the lumbar arteries, the iliac vessels, the sacral vessels, all of them are crossing. On the left side it will obviously left colic vessel, left gonadal vessel. So all the vessels which are crossing are listed here. Can go through renal artery, testicular or ovarian, together can be called as gonadal vessels, direct branches from abdominal aorta, internal iliac vessels, vesicle, the superior and inferior vesicle supplying the bladder. Of course, this ureter is ending in bladder, so it will be supplied by vesicle artery, middle rectal and female additional artery, uterine artery, because it also crosses, right? See, renal, gonadal, lumbar, directly from aorta, common iliac, internal iliac, middle rectal, superior, inferior vesicles, and in female additional artery will be the uterine artery. Venous drainage, similar names, replace the word artery by vein. They all end up in either the internal iliac vein or the inferior vena cava, the partner of abdominal aorta. So venous drainage is by corresponding names of the arteries. Lymphatic drainage is by some of the lymph nodes are in front of the abdominal aorta. So in front of the school there will be preschool. In front of abdominal aorta there is pre-aortic lymph node. By the side of aorta there are lymph nodes. By the side of medical course there will be paramedical course. So the para-aortic lymph nodes. So pre and para-aortic lymph nodes. In the pelvic area it is mainly internal iliac lymph nodes. Nerve supply, if you remember the referred pain scenario which I told in the beginning, the nerve supply of the ureter is by sympathetic and parasympathetic. Sympathetic is from which segment? T1, I'll give you option T7, T8, T9, T10. If you hold T10 in your mind, then you hold the correct answer. T10 segment will be the nerve supply. T10 to L1 spinal segment by forming renal, aortic and hypogastric plexus. Parasympathetic is by S2, S3, S4, pelvic splanchnic nerve. So these are nerves which are supplying the ureter. In summary, ureter is a fibromuscular tube connecting the hilum of the kidney to the urinary bladder. It transports the urine from the kidney to the bladder for temporary storage in the bladder before being eliminated in urethra. This fibromuscular tube is mainly made up of smooth muscles. In its wall also contains connective tissue. The minor calyx joints from major calyx joints from funnel-like extension called the pelvis of the ureter. The body of the ureter has got two parts: the abdominal part which remains in abdominal cavity, pelvic part which remains in pelvic cavity, intravesical portion. It descends vertically downwards, coinciding the tip of the transverse process of lumbar vertebra, crossing the sacroiliac joint, coinciding the greater sciatic notch on the lateral pelvic wall up to the ischial spine. It turns downward, forwards and medial to end up in the superolateral angle of the trigone of the urinary bladder. This ureter has got three constrictions. The first one is at this level, pelvic ureteric constriction. The second constriction at this level, the level of pelvic brim or the bifurcation of the common iliac vessels. The third constriction is the intravesicular portion or the vesico-ureteric junction. So what happens? It prevents the reflux of the urine. When the bladder wall contracts, it will constrict this ureter as well. So thereby urine is prevented from spilling up into the ureter. Instead, the urine goes down into the urethra. The infection of the urinary bladder is called cystitis. Urethra is called as urethritis. It's a lower urinary tract infection. The infection of the pelvis and the ureter and the nephrons is called pyelonephritis. That is the inflammation. This radiograph, what you are seeing is a contrast radiograph where the dye is descending down through this pelvic adhesion system, ureter, bladder. called descending pyelogram. Since the dye is injected into vein, it's called intravenous pyelogram. Kindly subscribe to our channel, press the bell.